Hello everyone, let's continue the next topic of CNS pharmacology, that is anti-epileptics. This is important, please concentrate. So there are four main categories of anti-epileptics which bring about a decrease in the epilepsy, that is anti-epileptics. First one are sodium channel blockers, next is calcium channel blocker, next is K plus blockers, that is potassium blockers, last is glutamate blocker. Okay, these are the four major ones which contribute for anti-epileptic action. What are the drugs coming under them? We will just follow through. Sodium valproate, lamotrigine, topiramate, phenytoin, fosphenytoin, carbamazepine, oxcarbamazepine, they fall under sodium blocker. Whereas in calcium channel blocker, we are going to see again sodium valproate, lamotrigine, topiramate, ethosuximide, gabapentin, phenobarbital. The third one is K plus blocker, that is phenytoin, fosphenytoin and retigabin. Okay, ultimately the last ones are glutamate inhibitors, sodium valproate, topiramate and levetiracetam. Okay. So what are the common side effects seen that is important? Okay, what are the common side effects seen? Most common is sedation, SLE like crash reaction, ataxia, weight gain in case of sodium valproate, weight loss in case of topiramate. This is the common side effects seen in case of all anti-epileptic drugs. So now we are going to concentrate each drug. Okay, the first drug is phenytoin. It is indicated in general tonic-clonic seizures and partial seizures, whereas its side effects are gum hypertrophy, pseudolymphoma, acne and vitamin K deficiency. Next is carbamazepine. It is indicated in case of general tonic-clonic seizures and it is a drug of choice in case of trigeminal neuralgia. So what are the side effects? It has a mnemonic called as cashless. Okay, cashless. Cerebellar ataxia, agranulocytosis, S for SIADH, H for hyponatremia and hypersensitivity reaction, L for liver toxicity, E for epilepsy, S for SLE and one more S for sexual dysfunction. Okay, that's why, because to decrease all these side effects, there was a new drug called as oxcarbamazepine, which is a new form of drug of carbamazepine, which is presently a drug of choice for trigeminal neuralgia, and it has less hyponatremia compared to carbamazepine. Okay, next we are going to deal with sodium valproate. Okay, sodium valproate. So sodium valproate, where and all is it indicated? It is indicated in absent seizures, that is atypical absent seizures, partial seizures, GTCS, that is generalized tonic-clonic seizures, myoclonic seizures, atonic seizures, mania as a part of BPD to stabilize the mood, and migraine prophylaxis. Okay, and migraine prophylaxis. So one more is the side effect. Okay, side effect of sodium valproate. You're going to name it a mnemonic as water plan. So W for weight gain, H for hormonal imbalance, that is PCOD, A for ataxia, T for tremors, one more A for alopecia, P for pancreatitis, H for hepatitis, last is for NTD, that is neural tube defects. These are the side effects and these are the indications of sodium valproate. Next you are going to see lamotrigine. Okay, lamotrigine, it is used as an add-on therapy previously, but presently it is active as monotherapy to all type of seizures, that is for like sodium valproate, same, it is preferred in all seizures except the absent seizures, but here absent seizures is also given, but here there is no absent seizures used. But the one more thing which is helpful here is it is used as a part of BPAD, that is bipolar affective disorder. In such cases it is preferred for depression. Okay, for depression management it is useful. Okay, for depression management it is useful. Here it is mania, here it was mania, here it is depression. Okay, to maintain mania, to decrease mania, sodium valproate is good, but to decrease depression as a part of bipolar affective disorder, lamotrigine is useful. Okay, so what are the side effects? Remember the mnemonic MD, MCH. These are the super specialty branches or specialty branches. Myoclonus, M for myoclonus, D for DIC, that is disseminated intravascular coagulation. M is for meningitis, which is a aseptic. Okay, it is aseptic. Cardiac conduction defects and hypersensitivity reaction. These are the side effects of lamotrigine. Next we are going to concentrate on topiramate. Next we'll concentrate on topiramate. Next we'll concentrate on topiramate. So it is treatment are indicated in case of resistance SPS, CPS and generalized tonic-clonic seizures, myoclonic seizures, add-on therapy in absent seizures and migraine prophylaxis. Okay, so what are the side effects? It causes weight loss, metabolic acidosis, renal stones and hypospadiasis. These are the side effects caused. So last is ethosuximide. Ethosuximide is a calcium inhibitor. It is used for typical, remember, typical absent seizures. As atypical is sodium valproate. Atypical is sodium valproate, whereas typical it is ethosuximide. Okay. What are the side effects caused here? GI disturbances, mood changes, headache and drowsiness. These are the side effects caused by ethosuximide. Next we are going to read about the pharmacokinetics of anti-epileptic drugs. So in case of pharmacokinetics, first is absorption. Phenytoin, it is bioinequivalent in case orally. Bioinequivalent. What does it mean? Orally, if you take phenytoin, different brands give different types of absorption. Whereas gabapentin, the only drug which follows zero in case of absorption. There are many drugs which follow gabapentin. Next is distribution. It has therapeutic index. If there is an TDM, that is therapeutic. So P is phenobarbital, carbamazepine and phenytoin. TDM, that is therapeutic drug monitor. Epileptic drugs, they are metabolized by liver. As liver enzyme indications of anti-epileptic drugs. Area, phenytoin is contract. It is conduct of hepatic encephalopathy. Next, we are going to discuss about how we are going to manage this. It is an emergency condition. How benzodiazepine use either IV at 2 mg per minute. Okay. And he did not give you a proper IV route. You are going to put IM midazolam. Okay. Within 3 to 4 hours, repeat the dose. Okay, repeat. IV bolus of phenytoin. IV bolus of maximum it will be 20 mg per kg. The other drug of can also be given. So after being again, if it is not phenytoin bolus, again if it is not controlled, repeat the dose. Even after giving these drugs, it is not controlled. It's going to give IV infusion propofol or midazolam. The last dot is phenobarbital.